Well, founder and CEO of Wella Health, Dr. Ipeme Neto, joins me now to discuss National Health Insurance Act and its implication on the health sector. Thank you for joining us.
Good day, and thank you for having me.
Now, the National Health Insurance Act was made to ensure that everyone takes advantage of the health insurance scheme. But then again, we see that a lot of people prefer the out-of-pocket treatment. I'm not sure if the word is prefer right now, or they trust the out-of-pocket treatment as against the health insurance scheme. What really would you say is the issue as we speak? What is the missing gap? What are we not getting right?
Absolutely. Like the report had said, over 70% of us pay out of pocket for our healthcare. On an absolute basis, that is well over $7 billion every year. Now, there are multiple reasons for that, and you touched on a couple of them. One, of course, is trust, is that people trust the cash in their pocket more than anybody or anything else. And so they would rather that when they are sick, they have cash in their pocket to go pay for care. Now, that is very inefficient, as we know. The other thing is education and awareness. People do not really understand that health insurance is available. They don't understand how it works, and they're not aware. And so there is a big gap that the health insurance players like the NHIA and the health maintenance organizations need to plug to create awareness and build education and that trust deficit in the general populace. So people go from spending cash to buying health insurance plans.
Now, Dr. Hanira is saying that the Nigerians have the responsibility to hold them accountable and demand better services from the health facilities owned by local councils as well as state and federal governments. I wonder what you say to that, if we are saying we need to address this as quickly as possible.
Yes, it's important there is significant community participation. So a lot of the healthcare, the way the new act is structured, is going to be provided within states and within primary healthcare centers. Now, every local government at the very least has a primary healthcare center. It is important that the people within that local government are aware of the primary healthcare center, are able to influence how it works, and go in there and demand that things are done appropriately. As the services there improve and there is accountability, you will find that trust increases and more people can actually access it. It's not uncommon for us in our local government areas to not really know where the primary healthcare centers are or even be bothered about the care that they provide. So I think the Minister of Health is absolutely right that that local community participation is really important.
And so where we find ourselves as it is now, beyond local government participation and holding persons to account, are we deliberately, creating that awareness, or we are just leaving things to chance as it stands for people to participate in the health insurance scheme? What does this portend for the health sector?
I think historically we haven't done a good job as an industry in creating awareness. That is changing, however, with this new act that makes it mandatory and the creation of state health insurance schemes and the mandate that they have to go out and create this awareness. Also, the act has created a new cadre of provider, the third-party administrator. Now, my company, Wella Health, is a third-party administrator. We help health insurance schemes, both private and state, to create awareness, to have agents on the ground that go around and train people on education, collect payments, and build trust. So agencies like ourselves, entities like ourselves are actually improving that awareness. And I'm confident that over the next few years, you will see massive adoption in health insurance, thanks to the efforts of the state, of course, health maintenance organizations, HMOs, and third-party administrators like ourselves.
All right, we'll leave the conversation here now. Dr. Ipeme Neto, founder and CEO of Wella Health. Thank you for your time.